I'm Dr. Fernando Garcia, and I am a bariatric surgeon, and my work resides in the city of Tijuana, Baja California, Mexico. I perform all the bariatric procedures such as gastric sleeve, gastric band, gastric application, gastric bypass, and duodenal switch. To complete these procedures, it is necessary to be competent and skilled. The main objective is to reduce the body weight, not so much for physical appearance, but with the aim to reverse the health problems caused by obesity. Bariatric surgery is currently the most effective treatment for weight control.
Well, obesity is a public health issue in all the world. So it's very important to be a part of a team that has the commitment and the skills to treat and diagnose and help to improve the quality of life of the patients.
It is really important for us to provide the patient with the skills and tools to help them get a better quality of life, to prevent cardiovascular disease, diabetes, and joint problems.
As a bariatric surgeon, I carefully select all the members of my team in order to accomplish each of the procedures in the most effective and caring manner to ensure the safety of our patients.
Today, actual tendencies in the world are going through 2 points mainly. One of them is quality of attention, and the second one is safety of the patient. As the patients of us are always foreign patients, we're gonna give them the safety and quality of attention since they fly to San Diego airport. There, prior to the surgery, during the surgery, and after the surgery, we give the best care with international standards.
As soon as the patient got to the hospital, one of the staff members welcomed them. We use the knowledge and the professionalism and the ethic with every patient.
So it's very important for us as a team to give them confidence and security with a lot of human treatment.
There is always the coordinator or me as a doctor to greet the patient. We make them feel secure in their room. We meet with the nurses, which are the ones that are going to be taking care of him.
Dr. Garcia creates an excellent environment so that we can work together for the patient, because for our team, the patient is the first.
Bariatric surgery is a safe procedure, but because of the risks associated with obesity, it is considered a major surgery. Because of this reason, our patient needs to be handled by a multidisciplinary group with the experience and knowledge necessary to accomplish the best results.
My name is Jose Luna. I assist Dr. Garcia in pre- and post-surgical assessment of the patient.
My name is Maria Edel Garcia Flores, and I'm an internal medicine doctor.
My name is Nancy Garcia, and my position in the company is surgical nurse.
Paola Velasco Gerardo, I'm a general doctor. I take care of the patients while they're in the hospital.
I am Victor Andres Cabrera Morales. I'm the anesthesiologist of Dr. Garcia's team.
Well, my name is Francisco Zabalza. I'm a general and bariatric surgeon.
And I start with a history clinic and all the medical background of the patients, so we can be sure that the surgical treatment will be the best for the patient.
As soon as the patient gets to the hospital, I interview, I do a physical exam, check laboratory test results to check that everything is fine for the surgery. And I talk to them about the procedure, about the risk, to explain the measure we have to follow to prevent complications.
As me as a general doctor and there's another internist, we will check on the patient prior to the surgery.
First, I receive the patient in the OR. Then, I position him in the surgical table, and then I start monitoring him. I put the electrocardiogram, I put the saturation monitor, I put the base monitor, and the muscle relaxant. After that, I start administering IV medications. But during that time, I talk with the patient so he doesn't be afraid or he can be more relaxed.
I'm a general surgeon and bariatric surgeon too, and I have the possibility to help Dr. Garcia in all procedures, in all the surgeries. I always hold the camera. I hold the camera with my left hand, and with my right hand I expose Dr. Garcia the surgical area so that he can work easier, faster, and with safety for the patients.
We do several tests after surgery, upper GI, and we do a methylene blue test to make sure that there is no complication for the surgery. We check as well pulmonary function and we give several medications to prevent any complication. We do nutritional advice and follow-up once the patient is at home.
That's why I have a multidisciplinary team with the experience needed for the procedures already discussed.
Dr. Garcia is a very skilled physician, and in combination with the skill of our teammates and the great ambience and human values that we manage, I think those are the main ingredients of our excellent service.
I know Dr. Fernando Garcia for the last 9 years. He is very honest, caring, human, dedicated, and very professional and honest physician.
Dr. Garcia put emphasis on teamwork, which brings excellent results and success.
Besides the fact that he's a good person, he's a high qualified skilled surgeon. And we as a team continue to improve our knowledge in bariatric and metabolic surgeries.
First of all, Dr. Garcia is a certified, a recognized bariatric surgeon. He has a really personal approach with the patient. He has good ethics. We as a medical team have the capacity, skills, knowledge, and technology to take care of any bariatric patient.
So if the patient has a doubt after the surgery, he can contact the team and we can answer all the questions they have.
Well, it's important to create a good bond with the patient because they are putting their life in our hands. It's important to us to give them security and confidence with our skills and knowledge.
The medical attention we provide the patient as a medical team is really close and personal. It's really important for us to make the patient feel secure, comfortable, and make a closer relationship with all the team.
My team members and I have a very open and constant communication to reduce the risk of any complications, and a complete success at the end of the surgical procedure, including a follow-up care once the patient is at home. I'm Dr. Fernando Garcia.